Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, a podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system. And frankly, screw that. Sick of it. And it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked with the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help a nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode.
Hey everyone, today we'll be talking to Kelly, who is a family nurse practitioner. Currently, she's working as a urology nurse practitioner in a urology practice. She's wanting to start her own urology practice where she will go to nursing homes, assisted living facilities, maybe some inpatient facilities. She's needing help with some malpractice insurance considerations, dealing with some non-competes, and basically just how to operate and start this business. So, hey Kelly, how are you?
I'm doing well. How are you? Thanks for having
Thanks
me.
for hopping on here.
Yeah, thank
All
you.
right, so tell us about yourself. I don't know if I've had a urology NP on here before or not. Maybe one time. So yeah, tell us about yourself. It's kind of interesting how you fell into urology.
Yeah, so my background, I was an ER nurse for about 15 years, and then I got my NP, and urology kind of just fell upon me, and I actually liked it a lot. And I was with a private practice for about 3 years, and then I went to like a competing private, like another urology group in the same area. Um, and now we're all one big happy family because we all got bought out by a private equity. So I'm seeing, I have been in my current spot. So I've done urology for 8 years. The past 5, I've been with the one company. Before all this changes with the private equity buying out, like I got the idea because I heard another podcast of some urologists about this girl that did on-site urology services, just basically like consults. Just, they have podiatry going into nursing homes, they have cardiology, and like no one has urology, so it's a very untapped market. So I did some hustle on my own and got into a place. I even had to like give our billing people information of how to do it. It was kind of, they were resistant. And my whole point was to try to get more patients, to get more RVUs, to make more money. And then things kind of just shifted. I made a significantly less amount of money than I did the year before with no change in my patients. And I'm just seeing the writing on the wall that it's just going to be a corporate, you know,
Shit
it's not going to be
show.
good. Yes, it's not going to be good.
Yeah, it's gonna
So
be. Yeah,
seeing this like very untapped market, I got my full practice authority and in the midst of like getting credentialed through Medicare and other insurers and trying to do it on my own. But I just
gotcha.
need a little push, I think.
Yeah, yeah. When corporations and private equity buy a business, it tends to fuck the business up.
Yeah,
It
I
makes it
can
a
see
shit
that.
show. Yeah, I mean, it makes it a shit show. So, like anyone out there who wants to sell their business, if you want to turn your business into a shit show, sell it to private equity. I mean, you're going to get paid for it. You're going to make some good money, but your business is not going to be the same business as it was before. Like, it's just not going to be. It's going to be worse.
Yeah.
Like, corporations are a great way to ruin a business. Anyways, though, yeah. So, okay. So you want to start this urology practice essentially and go out to different facilities, do urology consults, etc. You you made an interesting point. You said that this is an untapped market. So is this something that urologists really aren't doing?
Correct. Yeah.
So if someone's in a nursing home or an assisted living facility, they're actually gonna have to get out and go to a urology practice.
Oh yeah. Not only, yeah, they're not doing it. So yeah, like if we're waiting for patients, they come in a stretcher, they have a employee from the facility with them, they still know nothing about the patient, and you have this poor patient who's, it's like, why are we doing this? All they needed was a suprapubic change, like something like that. Or yeah, they're just not getting the care, and people don't care. It's just there's a lot of not caring in those, areas, and I think that's like an advantage I have because, and I
Yeah.
could help facilitate, like if they needed something more. Because like I said, I've already kind of been doing this with one facility. Like a guy, I couldn't get a Foley. He definitely had a stricture. I eventually got him to our office to scope him. Like it's like a way to like another one. I like got to go to the OR to get Botox, and it's just kind of facilitating things that they actually need, but like still working with the uro. I can't do it all, but
Right,
I
right.
can do a lot of it.
Interesting. I wonder if I bet you there's a need for that in a lot of specialties
Oh
like
yeah.
that. Yeah. So just FYI, everyone, like not just urology, but just like I'm sure that is applicable to most specialties. Like if you are good at something, you can go to nursing homes and assisted living facilities and stuff like that, and provide that service. You are probably going to do pretty well. And honestly, like you said, it's good. It's just good patient care. Like, come on, they don't need to get in a stretcher and go by an ambulance and all this kind of nonsense. Like, it's just total nonsense.
It is total
Um,
nonsense.
yeah. Okay. All right. Interesting. So, no, this is a pretty cool idea. I think this could probably do really, really well. Okay. So, what do you have started at this point? What do you have done for this business?
I have my LLC. I have. I also have someone who's helping me with credentialing, and then will eventually help me with billing. Um, I have a place that I go to now. Again, I don't know where to go with that because I'm currently billing under my current employer and I don't want to, but it's also not a convenient place. It's taking away from, my whole point was to get in, and then I was going to hustle, and then I just lost it because of not making money, you know. But I have a cardiologist has gotten in contact with me because he's seen my notes from the nursing home that I am at, and he has another one that he wants to get me into. And it sounds like it's a very large volume of patients. So I'm kind of in the process of hopefully getting on staff there with my full practice, like all my own LLC stuff.
Gotcha. Okay. All right. So, I mean, it sounds like you have just the very basic structure of this kind of done. Like, yeah. I mean, you pretty much have what you need to get started. I mean, it sounds like you pretty much have what you need to get credentialed probably and just go. You don't need an office. You don't need a bunch of, like, this is a pretty low cost kind of startup. You don't need a whole lot here because you're going to other places, right?
Correct. Yeah, there's really no overhead. There's also no risk really for the facility themselves because I'll be billing the insurers or Medicare. Basically they just
Right.
put me on, there's not much to it other
Yeah.
than getting the places, and
Right. You're probably going to need like some basic supplies and things like that, but that's whatever. You know what that is. And that stuff, honestly, is really not that expensive.
yeah.
Um, yeah. Okay. So I would say step number one here, Kelly, is probably, I would say you need to get credentialed. Your business needs to get credentialed. Like, number one, from this non-compete standpoint and all this kind of stuff, you cannot bill for this stuff through your employer.
Oh, no,
Like,
no. Yeah, no,
right.
I'm working on the credentialing there. That's in
Okay.
process. I
Okay.
have,
Okay.
but I don't have, I can't do different. I need to get malpractice insurance to like move forward with anything else other than like Medicare or something.
Yeah. Okay. So yeah. So get credentialed, right? You got your group MPI. You got all that
Yep.
fun
I
stuff.
got
Like,
all
just
that.
get all
Yep.
that. Right. Okay. Are you doing it yourself or are you using a medical biller?
Biller.
Yeah. Okay. Good. All right. Are they? Do they know what it is that you're doing? Do they have experience with this?
Apparently, it was actually a patient. A patient that he started. I was like, he's didn't have insurance, and I'm like, what? And he said he was working with doctors. I'm like, what do you do? And he's like, I actually help nurse practitioners start businesses. That kind of like closed the door and like, yeah. So he has, I forget how many he said, but yeah, he basically has done this before. I don't think it's necessary specific to urology, but practices in general.
Right. Okay. I'm curious if a medical biller who has experience with nursing homes and assisted living facilities and these different kinds of codes. This isn't just going to be E&M codes. I mean, like that's what I'm wondering. I'm
Yeah, I
wondering if
actually inquired about that with him because I said, would it benefit me if I got someone who knows correct coding and things? And he said, I'm familiar with it and I can help you. So
okay.
yeah,
All
so
right. I mean, the guy doesn't make money unless you make money, right? So,
exactly, exactly.
right. Okay. Okay. All right. So, okay. So you got that going. So this malpractice thing. So tell me what
hmm
your issue is.
So the numbers that I got, I was looking at different quotes. I knew it was going to be pricey, but so one was like 8,000 a year, but then there was another one that was like 1,500 a year. And it seems sketchy. I had someone look at it that does insurance, but not necessarily medical malpractice. And it seemed like it left out things like if I omitted to treat someone that I could get sued or something like that. Like I just my gut is telling me I should go with the more expensive one, but I just don't know. Because I've heard you say the name pro liability before. Is that one that you know or
Yeah. Was that the cheap one?
yeah.
Yeah. Pro liability tends to be pretty affordable. Um,
Or should I have someone
yeah.
look at it? Like I don't know which one to do. I mean, I would like to only pay $1,500 a year as opposed to 8,000, like, but I don't.
What? Who was the 8,000?
NSO?
Yeah, NSO is expensive just across the board. They're a
Really?
fucking ripoff. Yeah,
Hmm.
I, I,
I
I don't
figured that there was
recommend
another.
this. NSO takes advantage of nurses because they have nursing in the name, so they charge this premium. It's just like USAA. We're a bank for veterans. They don't give two shits about veterans. You know what I
Mm-hmm.
mean?
Yeah, yeah, yeah.
Care. They don't. It's a marketing ploy. I have never like every single time. Like I remember I had a lawyer review an NSO malpractice policy versus one I had from Berksey. This was like 5 years ago, and he was like, "It's essentially the same thing." He's like, "Why is this NSO one 3 times the amount?" I'm like, "Yeah, that's a good question. Why? It's because it's nursing. It's a marketing
Mm-hmm.
ploy. It's
Okay.
bullshit."
Yeah, that's
Yeah,
good.
yeah. I would no. NSO, throw it out. Throw
Got
the
it.
NSO one out. Just throw it out. Okay. I never recommend NSO to anybody. It is way too expensive for what it is. Yeah. So pro liability, yeah. What you need to look at is who's the underinsurer? Like who's actually insuring it? It's typically not like the company you're getting it through. They're typically getting it through a larger enterprise like Lloyd's of London or something like that. Like it's usually like or Berkshire Hathaway or something. Like it's usually like an actual huge insurer, 100, $200 billion company kind of a thing. So these guys are usually just more of like the middleman. It's like a business, and then they underwrite through another company basically. But from my understanding, CM&F Group, Pro Liability, Baxter are pretty good. I have my policies through CM&F Group, And I've never had an issue. Granted, I've never been sued, but I have had a lawyer review it before, and he was like, essentially, if what you're doing is within your scope, you're going to be covered.
Okay. I
So
think I think I actually did the CMNF. Is that what you said?
it tends to typically be more middle. Pro liability
Yeah,
tends to
I
be
think I got one
less
that was
than being. Yeah.
okay. All right. I'll look into that one.
Yeah, I think I'd probably just go with Seaman F Group. It seems like I don't know, it just to me it seems to be pretty legit. If you're doing something within your scope, obviously they're not going to cover you if you're performing surgery.
Yeah.
You know what I mean? But you have 8 years of urology experience behind you, and your scope of practice covers you for what it is that you're doing because you have the training behind you. For them to argue that you're doing something beyond your scope would be complete nonsense and be, you know what I mean?
Hmm.
They would have to insure you.
Okay.
So, and at the end of the day, Kelly, like I wouldn't worry too much about it. Like I are are you doing anything that's really high
No.
liability here?
No.
Right. Like
Giving.
you're not
No.
in the ER.
No.
ER is high liability.
Yeah, yeah,
Like,
yeah.
yeah, what you're doing here, I mean, come on. Like catheters and, strictures and, maybe complex UTIs and stuff. Like, I mean, is this stuff really that complicated? Not really. Yeah. So, I mean, is it really that risky? Probably not. So,
No.
I, yeah, I don't think I'd be too worried about it. And another thing, too, is these people are end of life. When someone sues you, it's usually there's an equation behind it to
Hmm.
determine what was their earning capacity, how much life did you take from them. All of these different things are factored into the calculation of what's going to be paid out. If you kill a 30-year-old, you're going to be screwed.
Yeah, yeah, yeah. For
You
sure.
kill an 80-year-old who has dementia,
Yeah.
what can you be sued for?
Yeah,
What
and
was
also these people aren't getting anything anyway. So it's like it was so I tried. You know what I mean? Like it's
Right. Like, I don't think I would worry too much about it. I would just get get a policy through CMNF and
okay.
call it a day. I wouldn't lose sleep over it.
All right, because this is what
And
kind of what's been holding me back. Because I'm like, which one do I do? Because I can't like finish with the credentialing until I get this. So it's like,
yeah,
it's kind of been
I get
holding
it.
me back. Yeah,
I get it. I get it. I get it. I get it. I just wouldn't worry about it. And another thing too is like, how much are you worth? Well, I mean, what can people come after in reality?
yeah, yeah. Not
Like, what are you worth? Do you have $1 million in your brokerage account, in your bank account?
God no. That's why I want to do this and start getting some money.
You can't get anything if you don't have anything,
Yeah.
right? Like, I see NPs creating like trusts and all of this stuff, and their net worth is negative 700,000.
Hmm.
It's like, why? You
Hmm.
don't have anything to take. Like, so I just don't think I'd worry too much about it. Now, I would worry about it when you start developing some assets. My asset protection lawyer told me, worry about it when you have about $500,000
Okay.
positive net worth.
Yeah.
So when
No.
you have $500,000 in like home equity, $500,000, worth of, some money in the bank, maybe some money in your brokerage account. Retirement accounts are usually protected, so you should be fine there. But like, that's when you need to start worrying about it. And also, you need to look up your homestead exemption in your state. So basically, what that means is in some states, I know like Texas is one of them, and I know Florida is one of them. The homestead exemption is 100%. That means that your home, if you get sued, your home, the value that you have in your home, the equity that you have in your home is 100% protected from any lawsuit. So look up the homestead exemption in your state. Everyone listening to this should know that number. Okay? Know the homestead exemption in your state. There is a reason why O.J. Simpson moved from California to Florida when he got sued. There is a reason why he bought a $20 million mansion in Florida because he got sued from whatever that lawsuit was from the family and got awarded, they got awarded $100 million or something. He moved all of his assets into a home in Florida and moved to Florida with 100% homestead exemption. They couldn't take his home.
Hmm.
So then what did he do? So what did he do? He just took home equity lines of credit out, and that's what he lived off of for the rest of his life. It's pretty smart. That's the game, right?
Yeah.
Yeah, that's why so many people are in Florida. It's probably why Donald Trump's house is worth $500 million,
Yeah.
right? Yeah.
All right.
So anyway,
Homestead.
homestead exemption, look that up. Everyone should know that number. Some states it's ridiculous. Some states it's like $50,000. It's nothing. So yeah. Anyways, okay, don't worry about it. Just get the CMNF group malpractice policy and call it a day.
Okay.
All right, and then go ahead and get the insurance credentialing done. That way
Okay.
you're credentialed and you're ready to rock and roll. Um, so yeah, that's pretty much where I would go with that. And it sounds like you already have some contracts or you have some connections with some facilities and stuff to get in the door. So that shouldn't be a problem for you.
Oh yeah, everything's so slow. The one place that I'm at right now, I guess that's my other question, how I can kind of segue this to I want to take it. You know what I mean? Like I want to have that facility. What I'm getting from them because of the volume, I could be seeing 20 patients a week where I'm seeing like seven, because of insurance issues. So I get the like non-compete, like, but no one else is doing it. And it's just so easy to get in there. I don't know. I don't know how to approach that.
Yeah, the non-compete issue's a problem. So number one, the first thing that I think or look about, or the thing I think about or what I look at with a non-compete is what's the radius? What's the radius on your non-compete from the facility that you work at?
I don't know. I don't know if it specifies that
It should
because,
because
or maybe it's not titled non-compete. I had it. I don't, yeah, I don't know. I'll have to look, but it's
there's
probably close to it's not that far from my office. So it's not.
typically it's typically it's 30 miles or 50 miles.
Yeah,
Typically that's
I'm
what it is.
such like a little minion that I don't eat like so low down here that I don't even know if the higher ups people even know what I'm doing. You know what I mean? Like it's like,
They they won't.
yeah, but
They won't
that's
unless you
why,
tell them.
yeah. So you're saying I never have to tell them
I
if I
would.
get new facilities?
You see a hornet's nest over there underneath that porch, you gonna go over there and hit it with a stick? Why the hell would you do that?
I know. So do I just
Like,
keep doing the nursing home that I'm doing? Like the reason I was doing it was trying to benefit my RVUs, right? To try to get more because I get bonuses off RVUs, which is now all going to be all messed up with all this new stuff. But so I was trying to get more business, and at this point I don't want to hustle for them anymore. If I were going to do
right,
it, I want to do it for me and do more. Do I need to
right.
leave that facility alone though because of this non-compete?
Does your clinic actually have a contract with that facility?
No,
What's the relationship there?
mine. It was again a patient of mine, and we got talking. The director of nursing, he got me in. Like, there's no contract with us. Like, I also got another nursing home that's close to my office, but that one there is a contract, so I'm not messing with that. But
Yeah,
this one, there's no contract. It's the only person doing this is me, and it's like it's turning out to be on my it feels like extra time because it's like not all that close. So I get there at 3. I'm getting home it's like I'm doing all these hours to do this hustle that's not really benefiting me. But this is the guy that got me into this and I want to like see his patients. Like that's his goal is for me to see. He's like, when are you gonna start with your other one? So you can see more people, that kind of deal.
So if there's a contract, you're right. I wouldn't touch it.
Yeah, I'm not touching that one. But
Yeah,
the other,
like if there's a contract, don't touch it. I wouldn't. If there isn't, what kind of legal ground do they have? There's no, there's nothing on paper,
right,
right? When there's anytime there's a lawsuit or something, there has to be stuff on paper, verbal agreements and handshakes and stuff. That shit doesn't fly. So if there's nothing on paper, then I wouldn't worry about it. And so I think that the place that you're at now, I personally probably would be okay with it. The one where there's a contract at, I definitely would not be okay with that.
yeah,
Um, Anywhere else that you guys don't have a contract with should be open to you because this isn't something that directly competes with them because you're not really stealing business from them because they're not in that business anyways, right? Like,
right. Yeah, you
right.
can't save them anyway. Yeah.
All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
And I know I don't want to talk to like the higher ups about all this, but like I'm not going there. But like my immediate bosses, like I will have to say I don't want to go here anymore. But then, well, what if they get wind of what I'm doing? You know what I mean? Like like I've never worked for people that like make you feel valued or respected and all that. And it was great, and I thought I would be there forever. And now, like, they have no say in anything anymore, pretty much, you know. So I wonder if I did a side conversation with them, I don't think it would go up. You know what I mean?
So
But
I
I
I
don't know.
don't know the kind of I don't know the kind of relationship you have with this person. I know, I'm just gonna give you an example. I know that with some of the relationships I've had with some of my higher ups, you know, I could have went in her office and she would just been like, I didn't hear any of that, Justin. Get the fuck out of my office.
Yeah,
You know what I mean? Like, and then I would go drinking with her after work.
yeah,
Like, you know what I mean? That was the kind of relationship I had with her. Like, so I don't know what kind of relationship you have with these people. So, like, that's going to be ultimately up to you. If it's a very, very solid relationship, a friendly, like, then you could tell them if you wanted to. But in my opinion, I would just say just shut your mouth. Like, just like don't stir the hornet's nest unnecessarily. Like why would you do that? There's no reason to do that at all. Just don't.
then what do
Like
I tell them? I just don't want to go to the nursing home anymore. I don't think it's worth it, because
yeah.
that has to be discussed. I mean, they don't even really know when I go, you know. It's kind
I,
of on my
I
own
would
time, turning out to be, you know.
I would
I
tell
like
them it's a waste of your time and I'm not going anymore. Leave it at
Yeah.
that.
I mean,
Like I
I'm
won't get
getting
anything
this.
out of it.
Yeah, I'm getting this new one where it's close and it makes sense because it takes 2 seconds to get there. But the other one's like driving downtown. It's like it's a mess.
Yeah.
Um, so you say
Just
just tell them that and leave it at that.
leave it at that. Be like, it's a waste of our time. It's not worth our time anymore. They don't take
Okay.
half of our insurance. I can't see half the patients. It's a complete waste of my time. It's a waste of our time. They'll probably be like, okay. And then you know what? And you know where their mind's going to go? To the next problem that they have. That's a
Yeah.
bigger problem. And they'll probably never think about it ever again.
And then just
Like,
shut my mouth about everything
and
else.
then just keep your mouth shut. Don't talk about it. Like, just don't. I have never talked about my businesses to employers ever. It's none of their business. You know what I mean?
Hmm.
Like, the urgent care that I was working at, I had a non compete where I couldn't do anything without their explicit permission. Well, I did that to that, and I just did it.
Hmm.
They didn't need to know, and I never
Yeah.
told them.
Yeah, it's
When I
funny.
quit 2 years down the road, whatever. Like,
Yeah, I just don't like. I had a non-compete when I went from the one urology group to the other one, and there's like three urology groups within the Chicago, like where Chicagoland area, and they all one of them didn't want to hire me because of non-compete, and these guys are like, that means nothing. And then a year later, we're all the same. Like it's like,
right. It means nothing.
yeah,
How much, this is the thing about non-competes. Most of the time, most of the time, I don't know what the percentage is. So I don't want to say a percentage, but I'm just going to say like most of the time, nobody cares. No one goes after you for it because it's not worth their time. It's not worth their money to spend on a lawyer to sue you
yeah,
and to go through
or
all the
what?
court
Yeah,
proceedings.
to
Why
get
would they?
nothing.
They don't get anything from it. Like if you owned your own practice and someone decided to start their own thing, 5 minutes down the street and started stealing your patients, okay, now you might have a claim against them for loss, for damages and things like that. Okay, that might be worth pursuing. But in this case, what is it worth pursuing? With my men's health clinic, one of my managers, she decided to go open up her own men's health clinic. And she decided she was going to try to steal a bunch of our patients. And so she stole probably about half of our patients. And I called her on the phone and I was like, listen, do you really want to fuck with me? That's what I told her. I was like, do you really want to rock and roll? Because I'm going to rock and roll. I know how much you made and I know what you're worth. You're not even worth 1% of what I'm worth. Do you really want to rock and roll? And she shut up and that was it. Right? It was a warning. It was a slap on her foot, slap on her
Mm,
hand. Even if she continued to do what she would have done, would I have spent the money on a lawyer to go after her and go? No, I
no,
wouldn't have. I don't want the headache. I don't want to deal with it. You know what I mean? I
yeah,
scared her. I left it at that.
there's so much shit going on right now with this whole buyout again and another buyout. It's like all right now. I'm like, now it's time to do it. Like
They have
no one
so
gives a
many.
shit about me.
They don't give a shit about you. They have so
Yeah,
much bigger fish to fry. You're nothing. Don't worry about it. I
exactly.
just wouldn't worry about it. I wouldn't worry
Yeah.
about it. Yeah. So
Okay.
do it. Yeah.
Let's
All
see.
right, so we knocked that out. So anything about the operational stuff of the business? I know you said kind of like you had maybe like some concerns or worries about how you're going to like operate this business, but I feel like if you get credentialed with insurance, you got your malpractice situated, your non-compete's not really much of an issue. Do you have any questions about like the business itself?
No, I mean, what do you? I know I need to like get a EMR, but I really need like a very basic, because I'll mainly be charting in the facilities charts, but I need something of my own.
To
Um,
bill, yeah.
yeah. And then I don't know, I'm just not a business person. So it's like hard to think like a scheduling
So
thing, like any of those things you recommend, or is there anything out there that's
yeah, so I mean, the thing about the business that you're going to do is that you don't really have patients scheduling with you, right? And so you're going to be using the facilities resources for the most part, right?
yeah,
You just need a way to bill.
yeah,
And so what you need is you need an EMR that can be loaded up in a browser on the computer there at the facility. And you're going to document within their EMR. And so you just need the ability to copy and paste what you type in there. And so you don't need templates. You don't need any of that stuff because their EMR is going to provide that for you. And so you finish the note there, click submit or click save, and then it'll populate it out on the screen, right? The entire note. You just copy and paste that and then paste it into your EMR. Any EMR can really, you can create your own note by hand, right? And so you just need something that's simple for your medical biller to use. So
okay,
you will just copy and paste. Like that's how I would imagine this would work. I would just copy the note that you put into the facility, copy it, paste it into your EMR, select a couple codes that you need to do or whatever, and click save, and then your biller then takes over from there. That's
Mm.
how I would imagine that would work. Now, I would ask your biller though, what do you actually need? Because you might be able to print off or save in a PDF or something the note and the what you submit to the insurance company through their EMR, like that super bill or whatever it is. You might be able to just save all of that out of their EMR and then just email it to them. So basically, you finish your note in their system, click download or whatever, and then just email it to yourself or upload it to a Google Drive or something. So I honestly think I would just ask your medical biller what would be the best way to do this from a billing standpoint, because from a note standpoint, like you're just going to document in their
Yeah.
chart.
Yeah.
Yeah.
I think there has to be something where like you can receive lab results, or I don't know. I'll ask him. I guess he's probably the um yeah. But it didn't
Yeah, how
sound
do you
expensive
get
at all.
right? How do you get the lab work from the facilities? So like I feel like really the only way that works is you get logins for every facility that you're in, because you're gonna have
Yeah,
to log
now that I think
in.
about it, that's how I get the ones I'm at now. I just log into their system and it's in theirs. I don't have, yeah, that shouldn't be a
Correct.
problem. So, and I don't think
Right.
that's much of an expense with like a very
No, it
simple,
shouldn't be. Yeah, it should be pretty simple. So just on a daily basis, you just make it part of your routine. The first thing you do in the morning when you wake up is to log into each one, review what you got to review, and just move on to the next one. And then you call it a day. Now, as you get busier, I would say probably as you get busier and you're seeing maybe more and more volume, let's say you get to a point where you're seeing 50 patients a week or something, like it gets really busy, at that point, having a virtual assistant or something to do a lot of that stuff for you probably wouldn't be a half bad idea, especially a virtual assistant who's medically trained to, go through these things for you and say, okay, there's red numbers on this lab work. I need to submit it to her. They can't interpret stuff or whatever, but
right,
you could
right.
have someone that could help you from an administrative standpoint, kind of help you, streamline processes. But I feel like that from this standpoint, though, your biggest concern is how do you bill? How do you get paid?
Yeah, that's, well, he says Medicare pays within 14 weeks. I don't know. That's the process. I have no idea.
Right, but the process of it, though, that's what you need to know. What's the
Okay.
process of it? How do I actually bill? Because I'm documenting
Oh,
in
you
their
mean like
EMR.
coding and stuff? Is that what you're talking about? Or
Right,
E&Ms
the
or, okay.
code, the super bill, the actual, like, how do I actually bill? Because I'm charting in their system.
Yeah.
So how do
Yeah,
we
yeah.
bill? How do we bill? That's the question I would be asking him.
Okay.
What's
Okay.
the process there? What do you want me to do there? That right there is probably one of the most critical things. Now, in terms of your schedule goes, I feel like that the facilities themselves should be scheduling this stuff for you within their system, because the nurse or the physician or whoever is there, they're going to be the one who says, okay, this guy needs a urology consult for this. So they should just be, they should just schedule you and notify you.
Yeah,
So,
so the way it is now, like I guess I need more something for like organizing myself for like follow-ups and stuff, because how it goes now, it's like, oh, they want to see someone, they want to see someone. So I just go see them. It's like I don't, and then I, in my own little calendar say follow up in a month, and I like have, it's not, I want something that's like more, I don't know. I don't necessarily need
so,
like a schedule, but something to like keep track of my patients, like when I'm seeing them.
so
If it's
yeah. No, no, I'm following. So then, I honestly think you could use something extremely simple here, because you're charting in their EMR. You don't really need a chart, and so I would use. I honestly, for something like this, I would like, the first thing that comes to my mind is Simple Practice,
okay.
because it's literally a blank form. So you open up a patient visit and it's just blank. You can load up a template to load up a note. In your case, you're just going to copy and paste what you documented there. Click paste it in Simple Practice, save, and then the patient, will then be in your system, and then on the schedule in Simple Practice, you can just be like, okay, 1 month from now, this day, this is the day that I'm at that facility. I'm gonna schedule this patient for 9 a.m. or whatever. And so then that way you can basically on Monday, Tuesday, Wednesday, Thursday, Friday, you can outline this day's at this facility, this day's at this facility, this day's at this facility. Then when you chart on the patient, you can say follow up, click, click, click on that day, boom, just pop them in there. The time doesn't really matter that much
No.
because you're just going to see whoever you see whenever you can, right?
Yeah.
But at least you have the patients, they're there. That way you're just in one system on your side, and you can call it a day. And Simple Practice, you can bill insurance through it. You can do all that stuff through it. So you can practically do everything that you want through Simple Practice, and it's like $75 a month. It's nothing.
Okay. That's good.
Yeah. I
Do
think
I
that's probably
need,
what I would do.
so obviously I want to see how this, I'm trying to, go slow and, well, not really that slow now that all this other stuff's happening, but my goal is to get out of where I am, but I'm going to be having to do this on the side and stuff. Um, where was I going with this? What? Yeah, never mind. Now I don't even remember where I was going with it.
Well, let me know. Well, let me know if this is where you were going with it. So, you're going to be working, and you're going to be doing this on the side. So, how do you manage your time? How do you really do this?
Yeah.
Right?
Yeah.
Okay. So, what's your schedule like at this practice?
Busy. I'm like a Monday through Friday, 9 to 5.
Yeah.
Like, and it's traffic. I have a 4-year-old. I'm already spread thin. So, um, I was hoping to do it. The advantage of these facilities is really doesn't matter when you go, I could go on the weekend. I could.
So, what I've done and what a lot of people have done, this is the same thing as opening up your own brick and mortar HRT practice. There's really no difference. You call Saturdays your day, and on that Saturday, you go to this facility from 9 to 12 or whatever, and then from 12 to 3, you go to this other facility, and then when you're done, you go home. You know what I mean? And you just
Mhm.
call it that for the time being, and you just make your money. And then as you begin to get busier and busier, you know, I don't know what your personal financial situation is like, but if you were able to do Saturday and Sunday for a period of a few months, and it's going to suck. It's not going to be fun. You're going to
Mhm.
have very little time. You're going to be burnt out. You're going to be tired, but this is just what you have to do. And so you do that for 3 months. And let's say you start filling up those days and you say, the amount of money that I'm billing in those 2 days is 70% of what I make Monday through Friday over here. Maybe I should just tell them I'm going to go part time. And then you just drop part time. And then you
Mhm.
just do Monday through Wednesday or something. And then Thursday and
Mhm.
Friday, you can start filling in there. And then eventually you get to a point where you're just like, I'm making more money now here than I am with my job. It's time to just quit. And let me just dive into this and find more facilities and stuff and start branching out. And then before you know it, you're working Monday through Friday for yourself, making $250,000, $300,000 a year.
Mhm. That's my goal.
Yeah. But you're going to be self employed, though. So I want you to realize that. You're not you're not going to have a business that works for you. You're going to be self-employed. You're going to work for your business. You will be a slave to your business. If you aren't seeing patients, you aren't making money. So you will be self-employed. So the issue with that is that you're essentially replacing one job for another one that you own. Now, the benefit there is obviously you get to keep all the gold, right?
Mhm.
Like all the spoils of war are yours. You don't have to share them with the king, you know? They're all yours, but you're still self-employed. And so what I want you to be thinking about as you grow this is how can I start having this work for me? And the way you're going to do that is you pay your dues, you get into these facilities, you see patients, you work, you establish relationships, you figure out the processes, you work your ass off for a year or two. And then at that point, you say, you know what? I don't want to do this all on my own anymore. I'm going to hire another NP to do it for me 20 hours a week. And now you pay them whatever you want to pay them, and you earn 20 or 30%. And then
Yeah.
you branch out across the state, all these facilities, and you hire NPs. That's how you build an enterprise level business that works for you. That should be your goal 3 to 4 years from now.
Well, I take back that's my goal on the first one. That is my goal.
That's your goal. Okay. All right. You're going to be self-employed though for the next year or two as you
Yeah.
figure this out. So just realize that.
Mm-hmm.
That's part of it though. Everyone
Yep.
does it. I've done it.
Yep.
Everyone has. It's part of the process. So, yeah. All right. Any other questions?
Now, I looked at some of your courses. Since I'm not in the like HRT, all that, is there one you recommend for like
Have you
me?
ta- have you taken any of them yet?
No, I just listened to your podcast.
Yeah. Um, honestly, for you, I would say probably the the mobile practice course might not be bad. It's pretty cheap. It's only a couple $100. The telemedicine one would be pretty good because it would just put your mind in the right place to build a business.
Okay.
We don't have a course specifically for this. Now, the new one that just came out, the skilled nursing facility rounding course that just came out, you could probably take a lot of gold from that course and apply it to what it is that you're doing. Now, a lot of the coding, a lot of the building, a lot of the things that that he talks about in that course isn't going to be 100% applicable to you, but the processes should be extremely applicable to you. So, like, honestly, listen, if it was me, I'd probably do the telemedicine course and I'd do that skilled nursing facility course. I would do both of those because you could probably do a lot of this telemed eventually at some point, some of these different things. And so I feel like it'd be a good way for you to like broaden your horizon, with it. And I think I would just do those two courses. I think everything else would be a waste of your time.
All right, cool.
Yeah. Any other questions?
All I can think of.
Okay.
Very helpful.
Well,
Thank you.
you're welcome. I'd like to end the episode with you asking me a question. You have a question for me? Curiosity? Or a
Well,
question?
you kind of, when you were first starting, like, what did you find your biggest challenge? Just because I think I already tapped on how I already feel spread thin. But what was your biggest challenge when you started?
I've been asked this question before, and my answer sometimes varies because it just depends on kind of where I'm at in my life right now, and I have time to think about things, like I kind of, I look back and, I guess stir on things. But I would say my biggest challenge really was, I would say it was probably just not being so anxious about shit. Like, just not worrying about every little detail. Like, I couldn't tell you how many countless nights I had of anxiety and panic and little sleep and waking up feeling like shit and just having to just drag my ass into some Suboxone clinic because I was working 1099 for $100 an hour so I could pay my MA at my men's health clinic, and like that's what I had to do. But like just being anxious, being paranoid, thinking about every single little tiny thing, every single liability, every single little possible fuck up I could have possibly have made. And if I could go back, I would have told younger Justin, 36-year-old Justin, I'm 41 now, I would have told 35, 36-year-old Justin, dude, I would have smacked him across his head and been like, chill the fuck out. The things that you are worrying about aren't things to worry about. Like, treat your patient well, collect payment, make sure you're covered with malpractice, and leave it at that. Everything else are minute details. Like, they really are. So I would just say try not to go down those anxiety, panic rabbit holes.
Okay. Good. Good advice. Thank you so much for this. Very helpful.
All right, you're welcome. All right, well, hope I was helpful, and I would love to know how this goes 6 months from now or something. So like, a lot of people never follow up, so like, I would love to know how you're doing. So by all means, you got my email.
All right. Awesome. Thank you so much.
All right, take care. Have
All
a good
right.
night.
You too. You too.
All right, bye. All right, hope everyone enjoyed the episode with Kelly. Pretty solid episode. Her idea is really, really interesting. I think that if you're looking for an interesting idea, she's on to something there. You don't have to be a urology NP, but if you have experience in a specialty and you could use that information, that knowledge in nursing homes, skilled nursing facilities, assisted living facilities, if you go there and do consults there, you would probably make pretty good money, especially if you had, half a dozen facilities to go to. So I think it's a pretty solid idea overall. I think the big thing is that don't get hung up by simple things like malpractice. She's been in this credentialing pause for a while. She's been in this area of starting her business where it's just been a complete just like roadblock because of malpractice. It's not that big of a deal, guys. Just get a malpractice policy and be done with it. You should be covered for what it is that you want to do, as long as what you're doing is within your scope of practice. So don't get hung up on the little details, all right? Just get your business going. Don't stay up at night. Don't worry about these little tiny things. Doesn't really matter that much. It really doesn't. Every NP that I've spoke to who has $1 million business, who has a practice that generates $100,000 a month, none of them got hung up on little details. Not a single one. Every single one of them got started, saw patients, collected money, treated patients, delivered good customer service, and that was it. Because that's all that matters. That's all that matters. All right? Deliver good care, deliver good customer service, collect payment. That's really all that matters, guys. Everything else is just a minute detail. What kind of LLC you have? Who cares? Doesn't matter. Like, it makes no difference. I get emails all the time from NPs. I'm going to, I have an LLC in Wyoming, but I'm going to be doing telemedicine in Washington State. Should I get a foreign LLC and blah, 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 blah? No, who cares? Just operate out of the Wyoming LLC. Doesn't matter. Makes no difference, all right? Just get going, guys. Don't worry about the little minute details. All right. Hope everyone enjoyed this conversation. Talk to you guys later. Bye.
Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.